Physician-assisted suicide. Imagine lying in your hospital bed with pain thrashing through your body. Your doctors and nurses explain to you that there is nothing else they can do for you, that you will have to live with this pain until it takes a final toll on your body. Shouldn't there be another option? Physician-assisted suicide should be legal in all 50 states because every person has the right to die. It can be used as the patient's last resort option and the Death with Dignity Act. Oregon, Washington, and Vermont are 3 of the 50 states that allow for patient-assisted suicide. These states have laws that allow mentally competent, terminally ill, adult state residents to voluntarily request and receive a prescription medication to hasten their death. In Montana, physician-assisted suicide is only legal via court ruling. All patients have the right to die. Every person that enters a hospital as a patient has the right to die. This meaning pertaining to, expressing, or advocating the right to refuse extraordinary measures intended to prolong someone's life when they are terminally ill or comatose. It's every patient's right to be treated with dignity and regard for your psychosocial, spiritual, and cultural beliefs by all healthcare providers. According to the American Medical Association, patient autonomy is the right of patients to make decisions about their medical care without their healthcare providers trying to influence their decision. Patient autonomy does allow for the healthcare providers to educate the patient, but does not allow the healthcare provider to make the decision for the patient. How much pain is too much pain for one to handle? Every patient has the right to control their own circumstances. Given certain circumstances, and there are no more options for the patient, physician-assisted suicide can be used as a last resort option. When a patient is terminally ill, meaning they have a disease that cannot be cured or treated, and that is expected to result in death of the patient within a short period of time, there is nothing more the doctors can do for them. Palliative care is one option for the terminally ill patients other than physician-assisted suicide. Palliative care is used in more cases because it is legal in all 50 states. The American Medical Association defines palliative care as specialized medical care for people with serious illnesses. It focuses on providing patients with relief from their symptoms, pain, and stress of the serious illness, whatever the diagnosis may be. The goal is to improve quality of life for the patient as well as the family. Palliative care can be very expensive and can prolong suffering and death. Certain states have made physician-assisted suicide legal with the help of the Death with Dignity Act. The Death with Dignity Act allows the terminally ill to end their lives through the voluntary self-administration of lethal medications expressly prescribed by a physician for that purpose. One must be 18 years or older, a resident of Oregon, Washington, or Vermont, capable of making and communicating healthcare decisions for him or herself, and diagnosed with a terminal illness that will lead to death within the next 6 months. 2 physicians must determine whether this criteria has been met. As a nation, one must collect information on the patients and the physicians who participate in the Death with Dignity Act. Statistics are created on the patient information as well. Physician-assisted suicide gives patients that fall into certain categories the right to end their own life. Religion plays a huge role in contradicting to patient suicide. As being a Catholic myself, I know that in the Bible it says one should never directly intend to cause one's own death or the death of an innocent victim by action or omission. In some cases, though, I think physician-assisted suicide should be legal. The Hippocratic Oath is taken by doctors, and physician-assisted suicide goes against it, specifically saying, "I will neither give a deadly drug to anybody who asks for it, nor will I make a suggestion to this effect." Physician-assisted suicide could also lead to non-critical patient suicide or other abuses. There are many reasons why physician-assisted suicide is illegal, but there are many reasons why it should be legal. If you aren't the one dying, why do you have a say in that patient's wishes, even if it is death? It's neither suicide nor euthanasia. Rather, a possible option if the pain from the underlying illness gets to be too much or the quality of life is degraded.